So good evening, everyone, and welcome to our first session for this year in our Mental Health and Thriving series. And I'm so excited to have Kristal here with us tonight from Launch Psychology. Kristal is a clinical psychologist and a neuropsychologist, and she's here tonight to talk to us about why it's important to have an assessment. And we thought this was a great topic because it's Education Month, and we wanted to talk about the importance of how an assessment can help particularly students when they're at university. And if we've got any time, we will hopefully touch on adults in the workplace. But tonight it's really about supporting young people and adults who are either returning to uni or who are starting out at uni and TAFE. So welcome to the show, Kristal.
Thanks so much for having me, Shae.
It's lovely to have you this evening and to be working so closely with you at the moment in providing assessments to anyone over the age of 18, really.
Yes, absolutely. I think really beneficial to have that chance to get to work together and collaborate on supporting people who might be struggling with various things.
So you've got two big titles as a clinical psychologist and neuropsychologist. Can you explain to us a little bit about what those two titles mean and how they how that helps when you're providing an assessment to someone who's coming to you that thinks they may have dyslexia?
Sure. So sorry, Shae, I might have missed a little bit before. So it's a psychologist and clinical neuropsychologist. So it probably sounds really minor, but they're not super big differences. But basically the difference is a clinical neuropsychologist. Our role is to I guess understand the relationships between brain and behaviour. So a lot of the work of clinical neuropsychologists is around assessment and being able to, I guess, understand different sorts of brain-based conditions, whether that's neurodevelopmental conditions or conditions in kind of older adults, which can affect brain functioning and kind of tie that to behaviour. And I guess a psychologist role, more generally, psychologist actually covers a whole range of different sorts of things. There's lots of different kinds of specialties. So neuropsychology is one specialty, which is all around kind of brain-based conditions, but there's other branches of psychology that might be more focused on supporting children. So there's educational and developmental psychology, there's clinical psychology, which looks at different types of mental health conditions and supporting those, as well as a whole range of different things. But I guess the distinction would be that psychology is more kind of broadly around supporting mental health, whereas neuropsychology has a specialization in supporting brain-based disorders.
And so do you mainly focus on assessment, or do you do assessment and interventions?
Yeah, so in my position, probably as a neuropsychologist, predominantly assessments the main kind of part of my or the bread and butter of my my work, but certainly more recently, I guess, intervention and sometimes that counselling aspect is also part of what I do as well.
And so can you walk us through if someone was to come to you and they needed, or they were looking for a dyslexic assessment, or there's multiple terms we can use, learning disability assessment or neurological disorder, what would the process be for that person, and why do you think it's important that someone comes to you for an assessment?
Yeah, great question. So the assessment process, there's a couple of parts to it. So probably I'd break it down into three major components for an assessment. So the very first component would be what we kind of call a initial interview, or sort of like a conversation between the clinician and the client, where they gather, lots of background information and history to gain an understanding of what the concern or difficulty might be. Sometimes that might also involve getting the client's permission to get some additional background information in the form of medical records or school reports that may also kind of inform their understanding of what might be going on for that person. So that's the first component. The second component, probably the component that most people sort of associate with assessment or think of when they think about assessment, is the formal testing part. And that involves a whole range of different sort of thinking tasks that look at lots of different thinking skills and thinking areas. So things like their verbal reasoning skills or visual spatial skills, attention, aspects of memory, processing speed. For dyslexia assessments in particular, often we'll also want to get a sense of educational skills and educational abilities, so things like reading, writing, spelling, and some of the processes that underlie those aspects as well. And I guess it's kind of doing a whole range of different tasks that I always think of it kind of like doing a tour of the brain. So it's kind of looking at lots of different areas of brain functioning to kind of get a holistic picture of someone. And I guess the very final part of an assessment process would be where kind of all that information gets drawn together. So bringing together what's found on the tests and what's found in conversation and the background information, pulling that together to kind of make sense of what that all means and how that might fit in with a person's kind of presenting concerns. And that, conversation about the results and pulling that together is usually what forms part of the feedback session.
And so is it only dyslexia that you can assess for, or are there other learning, if we say with the term learning disabilities, which covers, we use the word dysgraphia here. In the UK, they use a different term, but dyscalculia as well. Are you able to pick up those co-occurring difficulties that someone might have through your assessment?
Yeah, absolutely. So I guess the whole purpose of doing this whole kind of really broad range and kind of comprehensive gamut of tests is to be able to get a real sense of a person's individual strengths and weaknesses in different sorts of thinking areas. And often, I guess, a neuropsychologist's role is to be able to interpret and be able to bring together what those patterns of strengths and weaknesses look like, and if they might fit kind of a particular label or particular set of labels that makes sense of that person's pattern of difficulty.
And how do you find when you're assessing young people and adults that have come through for a dyslexic assessment or a learning disability assessment, how do you find their response usually if they receive that diagnosis?
Yeah, a really, really good question. And I think it can really depend on the person and the individual. So I think for a lot of people I'm going to speak about maybe learning difficulties specifically. I think for a lot of people with learning difficulties, there can be this sense for many of them that, something hasn't sort of felt quite right for them for some time. And kind of going through that assessment process and sometimes being able to get, a name with it can bring up, I guess, all sorts of different emotions. Sometimes it can be a real sense of relief, a sense of kind of validation that something that they felt wasn't, felt like there was something else kind of going on. It's been kind of been able to be brought out into the open, and there's been an acknowledgement and a term for what they're experiencing. I think sometimes as well, the thing about assessments is that, we don't just look at areas that are difficulties and that are weaknesses. We also often can find areas that are real strengths, or areas where a person, has, developed some, either, really good skills to kind of get by, as well as, areas of thinking strength. And so sometimes there's there can be this kind of worry that, going into assessment that, oh, I might find out I'm stupid, or, this is going to, show me some things that, it's just going to prove that, I was dumb and that's what I thought all along. And often it's the case that it's not that at all. That often, and I think, it's hardly ever that that's the case. It's more often, most of the time, 99% of the time, it's that, this person has some real strengths, and there are some, particular areas that may be weaknesses. And, acknowledging those strengths, I think, is also a really powerful and validating thing as well.
So are you able to, when you do your final report, and do you write about people's strengths and how they may be able to use those to help them either in studies or in the workplace?
Yeah, absolutely. So I think a lot of the time with learning difficulties, there might be, specific aspects, depending on that person, that they find some things particularly challenging. But there's often, other areas or strategies or things that they can do that helps them to kind of work around those difficulties and be able to use their strengths to be able to support those. And that's always sort of included in a formal report within kind of recommendations. And those recommendations can go towards the information that can either be, if they're studying, having some of those strategies being included that can support, tutors or that individual themselves or other teaching staff to know the learning methods that work best for that individual. And could also, if they're in a workplace, depending on the workplace, that can also be information, if that individual is comfortable with it, to share with their employer as well, to access some different means by which they can, best be supported to, do their best work.
And so in your opinion, what would be the main reasons that you think someone should come and get an assessment? And particularly because we're talking about Education Month this month, if it's a young person, an adult that's starting out in TAFE or university, or people who might be returning that have been struggling, what do you think, or how do you think an assessment would help them? I mean, you've touched on that a little bit already, but why do you think it's important?
Yeah. So I think, again, this sort of sense of, sometimes we can come across people who, have really found that they're really struggling in aspects of if they're studying, it might be study, or if it might be work, they might have found that things might have reached a point where they're really struggling at work, and there's a sense that, stuff is really hard and really tough, and it's hard to know kind of what to do when that, can be really, really tough and really, really stressful for a person to go through. Having, I guess, one of the benefits of being able to have an assessment is that, when we kind of don't know what it is that's going on, it makes it harder to be able to know what we can do about it. So I guess an assessment's focus is really being able to support a person to get, I guess, an understanding and where applicable, a name for what they might be experiencing and what kind of what's the pattern of difficulties that we might be seeing, and that enables, when we have that insight, it enables us to be able to access different levels of support or different ways of working that they may need, that can really make a very big difference, in an individual's life, and actually allows them to sort of display what their potential is as well. Sometimes it's that, the way that work has been going for them, or the way that study has been looking for them, it hasn't given them that opportunity to show that potential that they do have. So it's an opportunity, when we know what's going on, that we can I guess, tap into those strengths and acknowledge what those strengths are.
That's a really nice way of putting it, because I think we get so caught up in the challenges or the struggles that we're having, and that a report can say to us that I know for me personally, when I was diagnosed, that I couldn't do this, or I was really low in certain areas, and that really affected me and my mental health. And I think if you look at it from a strength-based approach, like you've been talking about, I think it can really help reframe for people what they're going through and what they're seeing. It's not just that you can't do things or that you have a disability, depending on what term you want to use, but that you do have a lot of strengths as well.
Yeah, absolutely. It's I think it's really easy in learning disorders, and probably not just learning disorders, maybe in a society and more generally, that it's really easy to kind of focus on problems or things that are going wrong, when in reality, obviously, a person is so much more than just that one thing. There's a broad picture, and there's also, many people who have learning disabilities also have some really, really great and probably remarkable strengths as well. And I think that's a really, really important part to be able to acknowledge and I guess have a chance to discover as well, which can, sometimes be something that we can get to through an assessment.
And for our listeners out there that might be heading into TAFE or university, further information that they can use that assessment to then take that to get support from their education institute.
Yeah, absolutely. So I'd say these days, and it's really great that this is the case, most universities, I can't think of many that don't, but most universities will have kind of a department or a branch, which is kind of the learning and support, or kind of the equity and diversity branch. And a lot of their work is centered around supporting students who have learning differences to be able to access adjustments or accommodations, whether that's kind of adjustments in terms of how learning content needs to be delivered, or whether that's adjustments to exams or assessments, kind of formal aspects of their learning. That they're able to often use information that they receive from reports, obviously with that person's permission, to then be able to kind of put some of those recommendations and strategies or accommodations in place to make that learning environment, look different and work in a better way for that person.
So what would be, just generally, because every individual is different, but are there general accommodations that you might suggest in someone that was wanting to go back to study or was studying and had just had a diagnosis that would be useful when they go to school or uni?
Yeah. So I think some of the common types of learning adjustments might be things like, being able to having additional reading time, whether that's in the examinations, that can be something that's really helpful, or things around, workload adjustments if needed. Having kind of different formats and means for assessment as well. So for some people, it might be that when there's, a really high volume of reading content, that's not the best way for them to be able to demonstrate their knowledge, or when there's lots of written content, that might not be the best way to demonstrate their knowledge. So having alternatives such as maybe in a university, sometimes they can have a scribe, so someone who can write down and help with the note-taking aspects, or it might be being able to do an oral presentation, which might be the way that they can communicate their knowledge the best and more effectively, compared with writing or other means. So those are sort of some of the common kinds of accommodations and adjustments that can really help.
And if we think about when a person transitions from education into the workplace, does that assessment travel with them? Are those accommodations, do you think, appropriate in the workplace, or how does one need to go back and get reassessed so that they can have something to help them in the workplace? I mean, disclosure is such a big issue, and a lot of people won't disclose that they've got dyslexia, and we always talk about how an assessment can help them if they want to disclose, to give evidence as to why they might be struggling. So what do you think the pathway would be as someone transitions out of education into the workplace?
That's a really good and kind of interesting question.
Have I thrown you a curveball?
I think, so I guess it depends. So some people may feel that the information in an existing assessment that was sort of done, while they were studying, has accommodations and recommendations that are still relevant within the workplace, in which case then, if that person feels comfortable, then they may kind of wish to share that report. Sometimes it may be that the nature of the workplace and the demands of the workplace look very different from what things look like within a kind of study-based setting. It may kind of be up to that individual and a discussion with the assessing psychologist whether there would be benefit to I guess doing another assessment to kind of review what the needs are. Or it might be that the formal process might not need to kind of happen all over again, but it might just be kind of like a conversation or consultation around what the needs are, and they might be able to prepare something that can be adapted based on the assessment that's been done previously, and can be written as like a letter or something that goes towards the workplace. So that can be another pathway, but certainly it'd be something that a professional would be able to help and support with.
That's really great advice, because what we find is one of the biggest barriers to assessment is cost, as we briefly touched on before we started the interview. And it saddens me greatly that so many people are missing out because of the cost of an assessment, because it's not claimable on MBS at the moment, and we're not covered under NDIS for that help as well. So I think if people know that they're able to have something like you've said, a letter or a review that gives strategies in the workplace, is a really helpful tip for people. And do you think I know that the Australian Psychology Society has been strongly advocating for neuropsychologists to be able to claim under MBS. Are there strategies, do you think, that we can help people around assessments and how we might be able to support them in accessing them? That's a really tricky question, and
yeah,
you may not have an answer to it.
Yeah, ways to support getting access to assessments. Yeah, I think you raise. I completely agree. It's a really, really tricky issue. So, I mean, let's be honest, most assessments unfortunately cost sort of in the thousands. And unfortunately, when they're not subsidized by Medicare, it does, make it a barrier for many people, which is, really unfortunate that that's the case. There are some other options, I guess. There can be a range of options in terms of accessing assessments. So sometimes some of the lower cost options might be things like, so sometimes university clinics can have lower cost assessment options. That's not to say that they're, ideal either. They're still quite, they can still be expensive. But I guess the other means of, accessing support might be, some of linking in with, some of the work that you've done as well, Shae, foundations like yours, where there's advocacy and even options to link in with a network of other people who might be kind of going through that process or have gone through that process. It's a means of gaining, information. I guess the other thing is that sometimes that, aside from a learning disability, sometimes people might find that there's other aspects that they are struggling with, and it's actually more about having a space to talk about some of the associated struggles that they might have. And I guess another pathway to supporting those aspects would be, Medicare does subsidize for, counselling-based support. So, that can be another means of, while not necessarily an assessment or diagnosis, some people might just want that space to be able to discuss sort of the impacts that, a learning disability might have on them. And sometimes a psychologist can be a way to, talk about what that experience is like, and even sort of suggest some means that might be able to be helpful for them.
I think that's a really great suggestion and strategy for people, because we're always talking about, well, like tonight, the Mental Health and Thriving series, how important looking after our mental health and well-being is. And, I think the option of being able to talk to a psychologist, and now, there's 20 sessions, I think, with a clinical psychologist, but also through the chronic disease management plan, you can access some allied health help as well. That it's good to talk about what other options there are if you can't afford that formal assessment. And I really hope in time the advocacy work we've been doing with federal government around getting dyslexia assessments on MBS and under NDIS, hopefully one day that will change. But it's really disheartening to think how many people are missing out on that opportunity. So those suggestions, I think, will be really helpful. Thank you.
Yeah, I agree. And, really, I guess, kudos to you and your foundation as well for doing all that, really hard advocacy work, because I guess it's all of those little efforts and all of those voices together that we can hopefully start to see some change. And I think you're absolutely right. It's definitely an area that needs more focus and attention, particularly given that we know, just how common learning disabilities are and learning difficulties are. Yeah.
So before we open it up to any questions from our guests that have joined us this evening, are there any final comments you'd like to make around assessments, particularly for those people that are returning to study or that are studying at the moment?
Yeah, I think, I guess if there's kind of one point I really would like to reiterate is, like I said, I think it's really common for many people who've been struggling to feel really nervous about the assessment process, and it's really understandable a lot of the time. people may have been kind of going along for a fair while, you know, doing the best that they can, and you know, feeling like they sort of have to just, you know, grit their teeth and kind of push through. I think I want to sort of reiterate that kind of or kind of debunk that thought that, you know, assessment, I think there's often that fear, like I said, that, you know, assessments might find out that I'm dumb, or it's going to reveal something, you know, really awful about me. And, you know, the reality is a lot of people actually find that when they attend the assessment, it's actually, it might be a little confronting at first, but once they sort of get into it and they sort of get through some of the different tasks, they start to discover there's actually, you know, a lot more to them and their thinking skills than just what they thought. And it's more often than not, it's sort of met with a sense of real relief kind of on the other end when they've been through that process. So yeah.
Such a positive message, and I wish I'd heard this message when I was 27, because it may have changed my response to my diagnosis at the time, because it was very deficit-based rather than strength-based. And it's interesting to see the change over 10 years around the language used. It's so positive, and I really hope that people that watch this tonight can see the take away positives from it rather than just the challenges they might be facing.
Yeah, absolutely. I think mental health grows and continues to grow. I mean, psychology still has lots to continue to learn, but there's been some really good and big kind of positive steps, I think we can at least say, in the learning disabilities space. And I hope that can continue to be the case.
Well, thank you so much for your time, Kristal. It's wonderful to have the opportunity to talk to you, and that we get to work with Launch Psychology in the way that we do. Before we finish up, I just see if we have any questions from our guest this evening. Sorry, Judith, you're just on mute. I'll unmute you. Oh. No, I couldn't unmute you. There you go.
Okay, can you hear me now?
Yes, we can.
Just sort of referring back to what you were saying, Kristal, about most people react sort of positively. I was going to ask you, you know, sort of what the sort of average response is. Is it sort of overwhelming relief or otherwise?
Yeah, I think a lot of the time, you know, there's this kind of sense of anticipation, I think, and kind of after hearing it, there can be some mixed feelings, but in the end, it's actually often, I think, a sense of, you know, I've been heard, I've been understood, and, you know, there is a sense of kind of, you know, relief in that. I guess often what can be most frightening for many people is the unknown. And I guess when we can bring things kind of out into the open, it's a kind of cathartic feeling, I think, for many people. And so I'd say, you know, more often than not, it's a process that you know, allows people to kind of start that journey towards some acceptance, I think, of themselves, or a part of themselves, I should say.
It's surprising that so many people know the word dyslexia, and even when they've been assessed and you mention the word dyslexia back to them, even though they don't know what dyslexia is, just hearing that word can give them reassurance that they're not dumb, they're not stupid, and see the rest of their lives really falling back into place. Experiences, what Shae went through, I think was atypical, yes, but you can understand it.
Absolutely.
There's a lack of knowledge of what dyslexia is. But You're doing a grand job. Well done. Thank you.
We could have a whole separate session on differences in assessment between Australia and the UK. They have but we'll leave that for another time. Was there any other questions before we wrap up this evening? No, doesn't look like it. Well, thank you so much, Kristal, for coming on the show. It's been really interesting talking to you, and I've learned a lot, even though I've been through the assessment process. To hear the way you spoke about it tonight was just so reassuring, and I think it will really help a lot of people who might be thinking that they have dyslexia or learning disability and need some extra help. So thank you so much for your time. I really, really appreciate it.
Well, thank you again for having me, Shae, and thanks for a lovely Wednesday way to spend the Wednesday evening. I hope it is helpful to people.